So today we're going to be talking about more of a general approach to cognitive behavioral therapy. So this is kind of just going to be for the public rather than specifically for patients. So just some background information on CBT. It's basically just a combination of cognitive therapy and behavioral therapy. So cognitive therapy is basically where you form more correct ideas of your thoughts, attitudes, and expectations rather than using things like negative thought loops, cognitive distortions, or like a self-fulfilling prophecy kind of thing. Behavioral therapy is more where you kind of determine the behaviors that are productive and ones that are not, and then work on changing the habits that you find are unproductive in your life or maybe that are dangerous for you. And it can also be used to help find like relaxing exercises that help you, like grounding techniques and deep breathing, that mainly is focused on changing the negative behaviors. So CBT really focuses on present behaviors. It doesn't really go into the past like psychoanalytic therapy does, but it's more like problem oriented, and you really focus on the future and what you want to change now to better your life in the future, I guess. So it's really used to treat depression, anxiety, eating disorders, OCD, and addiction, but it can also be used just in the general public. If you have a basic understanding of CBT, you can really use it in everyday life. And when it's used in therapy, it's really dependent on patient initiative. Obviously, no one can change someone else's thoughts, so it's important that the patient really has some motivation to change their own thoughts, or else it's really not going to be effective. So I briefly touched on cognitive distortions, and I really wanted to kind of go into those a little bit more. So these are basically inaccurate thought patterns, oftentimes are irrational, but they're pretty much present in all of the population, not just people who have a mental disorder or mental illness. So some examples of these, there's a lot more than what I have listed, but these are the most common ones. Catastrophizing, which is basically predicting a really bad outcome out of any situation and not really focusing on the positives. Mind reading would be assuming that you know what someone else thinks. All or nothing thinking would be saying a phrase with the word never or always, like I'm never going to understand how to do this, or I'm always going to be bad at this particular subject, and not really allowing for any wiggle room to do anything different. Jumping to conclusions, pretty obvious one. It's just without having all the information, you just kind of conclude that one thing is going to happen over the other. And predicting the future would be just predicting that something is going to happen when you don't really know it will, and oftentimes that's a negative thing. So we normally don't predict the future in a positive way, you know. So I also wanted to briefly touch on automatic negative thoughts, which are basically things that we think about in everyday life. They're reflexive, spontaneous thoughts. They don't require any prior thinking to them, so they oftentimes just pop up. And normally they're pretty short and concise, so they'll be like, if you did something wrong, you might say, I'm so stupid, or if you did badly on a test, you might consider yourself a failure. And those are just thoughts that really pop up really quickly, and they're not really things that we attempt to think about. And oftentimes, even though they're negative, they're also learned. So they're basically things that we've thought our whole lives based on our core values and beliefs. So if you have a core value such as, you know, maybe you value intelligence and you did badly in a certain subject or something like that, your automatic negative thought might be, I'm a failure, like I'm just not intelligent and I'm not productive and I'm not a hard worker or something like that. Most of these automatic negative thoughts, in fact, pretty much all of them are irrational, but we don't really work on changing them because to us they're normal. Like sometimes we don't even notice them because they're just things that pop up in everyday life, and since we've had them for so long, like we just don't question why we have them and what we could think differently. So who could benefit from using CBT? Even though it's a therapy-based practice, it can really be used by anyone. Like I said before, if you have a general knowledge of CBT, you can use it for yourself. So, I mean, do you have recurring negative thoughts? Do you tell yourself stories that are negative? Do you find yourself stuck in thought patterns or behavior cycles? All of those things should indicate that CBT might be a good practice for you to use, and it doesn't have to be used in therapy. Obviously, like I said, it can be used in everyday life. So how exactly do you use CBT? So there are two methods that I've learned about and I found most helpful, which are the ABC method and the 3Cs method. So the ABC method has an activating event, a belief, and a consequence. So the activating event is essentially the trigger or the life event. The belief is your thought about the trigger or the life event, and the consequence is a feeling or behavior that comes from the thought that you have. So perhaps you were yelled at by your boss, which would be the activating event. Your belief is that, everyone just hates me, I am a horrible employee, I just suck at my job, and your consequence might be that you genuinely quit, or you just feel stupid, or you feel embarrassed. So that would be an example of using the ABC method, and that really helps to sort out your thoughts and kind of think about why your behavior or your feeling was the way it was, like what caused that. The 3Cs method is basically just a way of remembering catch it, challenge it, change it, which is catching a thought, challenging it, and then changing it, like it says. So maybe your thought is, so if you have like an eating disorder, maybe your thought would be, I don't deserve food. And then you're challenging it might be saying, well, I think other people deserve food, then why do I not think I deserve food? And so you're changing it might be, and changing it might not be like a super positive thought. You might not be able to go from a really negative thought to a super positive one, so you can go to a more neutral thought. So you could say to yourself, like, I'm a human being, all living beings need food, and I deserve food too. Something like that. So we also want to talk about using coping skills that are different than our negative behavior patterns. So oftentimes, if you use a certain behavior, like maybe you're addicted to drugs, or you're an alcoholic, or you have an eating disorder, you use eating disorder behaviors, a lot of those become coping mechanisms. So it's important to replace that negative behavior with more positive coping skills. So these are really dependent on the individual. I mean, different things work for different people, but some examples are journaling or writing, crafting, or doing other forms of art, joyful movement, like going on walks or doing whatever kind of exercise you actually enjoy, distractions, so you could watch TV, you could read a book, you could do crossword puzzles or something like that, knit, distress tolerance, which is basically just doing something that's really challenging, but just sitting with the distress and doing it anyway, talking it out with someone who cares, or even just writing about it. Sometimes that's kind of a form of talking it out, and doing other forms of self-care, like taking a shower, taking a bath, doing a face mask, painting your nails, something like that, doing yoga maybe. So if you have a loved one who is using CBT as a therapy-based practice, there are a few things that you can do to help them really utilize this successfully. So you can prompt them to use CBT when they express irrational or inaccurate thoughts, when they are struggling with behavior urges, or when their thoughts are negative rather than positive or neutral. So once again, the thought that they come up with that's different than their negative thought does not have to be positive. It can just be neutral. Sometimes negative thoughts are so powerful and so ingrained in us that it's really hard to think differently about it. So it can be really helpful to just think of a neutral thought, and that can really be a fact. So say someone looks in the mirror and they think, I'm too big, I need to lose weight. That's kind of more of an opinion-based thing, and it can also be a distorted body image thing. So maybe a fact that they tell themselves is, I'm wearing glasses, or I have a red shirt on today, something that's a fact rather than a belief. You could also provide them with evidence to support more neutral thoughts. So oftentimes it can be hard to think of evidence for the changed thought rather than the thought that they believed in the first place. So you can help with them with that. You can also support them in helping stop the behaviors, which will help, and point out when their thoughts aren't CBT based. So that is basically just a brief explanation of cognitive behavioral therapy. If you want more of an explanation, I do have a longer video on, it's basically for more like patient-based, like my clients, to look at, but you can watch that video if you want a little bit more information.